Today, I am with Dr. Dan Macera. Dan, tell us, how has your role as a physical therapist evolved and changed through this COVID pandemic?
Hi, Michelle. Yeah, it's definitely changed quite a bit. I am a clinic director with my company as well as a treating physical therapist. And from treating patients, it's definitely changed quite a bit as far as, transitioning some patients over to telehealth and doing virtual visits. Patients that are coming into the clinic, obviously taking additional precautions, trying to space things out. But in addition to that, it's been challenging to manage both staff and patients' fears, anxieties, and some of the things associated with what's going on right now with this pandemic. I think that staff in particular, and myself included, have gone through kind of a roller coaster of emotions where first we didn't have a lot of information about what was going on. So having to say, all right, well, what should we do? Should we cancel all of our patients? Should we switch everyone to telehealth? Should we advocate for people to keep coming into the clinic? So that was one kind of thing we had to kind of muddle through and figure out. And obviously over the last few weeks, there's been more and more information coming out, which has helped to clarify our mindset and our thoughts and what we've recommended to our therapists. So I think early on, I tried to let our staff know, and then they in turn kind of push this information to our patients saying, all right, those who are high risk, even moderate risk for what they were saying for this COVID-19 pandemic, we want to transition those patients to telehealth and try to make sure we're continuing to touch base with them, continuing to follow up, progressing home exercise program, things like that, but pushing those more to virtual visits. And then we had our lower risk, or people who just had surgery or had severe acute pain. Those are the people that we want to continue to come into the clinic and advocate that we're changing our systems. We're wearing PPE, we're taking temperatures, and it's a safe environment for you to come in as long as you feel comfortable. And then over the last few weeks, we've kind of shifted that to saying, all right, our high risk population, now that we know more information, those high risk patients, we still want to do telehealth, but we can advocate for more of those lower risk people to come in and try to transition them back into the clinic. So I think it's been difficult to manage both, again, the emotions of staff and making sure that we're all on the same page with that. And then obviously our patients as well. And it's definitely been a transition. I feel like there's a little bit more clarity every week as we get more information. So that's been helpful. That's been good.
I think it's amazing how communication is, as physical therapists, we've all had to learn how to communicate in very different ways with so much unknown and many different challenges, not just with our colleagues, but with our patients as well. Tell us about your teaching down at URI. How's that role evolved?
Yeah, so I'm an adjunct professor for orthopedics at URI. So we've had to transition. So the class itself is a huge component of it is lab-based, getting our hands on, practicing different types of special tests and manual therapy techniques. And the challenge has been kind of shifting that into more of a virtual setting. So we've moved to virtual lectures for the actual content. And then we kind of split the class into small groups between myself and the other professors who teach it to try to show videos on different techniques, talk through them. I've been fortunate because I'm still in the clinic. I've had clinical staff work with me to try to demonstrate some techniques as well. And then those students that have somebody at home, whether it be a spouse, sibling, or even just a friend who's staying with them, they're able to practice some of these techniques. So it's definitely been challenging, much different than how we've done things in the past. But on a positive note, the feedback we've gotten is that certain aspects of how we've changed it, students have really enjoyed. And they've asked to take aspects such as breaking into these small groups and getting the opportunity to work with only 5 or 6 students per faculty member. They've really enjoyed that, and that's something we never really did in the past. So I think we'll take aspects of this, adopt it, and kind of move it into our future classes.
Well, let's hope that we're all learning things through this pandemic that will help us in the future, whether it's how to integrate telehealth into our practices or how to have these smaller groups when we are teaching. So Dan, thank you very much. All the best for you and your teams.